In 30 years of orthopedic practice, I've seen tens of thousands of patients with knee pain. Every day, people come to me with same complaints: pain when walking, pain climbing stairs, morning pain, joint cracking. And you know what's most interesting? 97% of them have no idea about the real cause of their pain. They think the problem is cartilage, arthritis, age, excess weight, and yes, all this can play a role. But there's one cause almost nobody knows about, and it's behind most cases of chronic knee pain. Today I'll tell you about this hidden cause, and when you learn it, much will fall into place. I'll start with a story. Recently, a woman came to me, 48 years old. Let's call her Marina. Right knee pain tormented her for 2 years. She did MRI, which showed minor changes, slight cartilage thinning, nothing catastrophic. Doctors told her standard things: it's age, arthritis starting, take chondroprotectors. She took them 6 months, no result. Then tried physical therapy, temporary relief, but pain returned. Hyaluronic acid injections helped for a month, then everything came back. When Marina came to me, she was on verge of despair. Doctor, I don't know what else to do. Everyone says different things. Nothing helps long term. I looked at her MRI. Indeed, minor changes, but nothing that could explain such severe pain. Then I did what I always do, asked her to simply stand and walk across my office, 10 steps. And I saw it. When Marina walked, her right foot turned outward about 15 degrees more than left. Not much, imperceptible to non-specialists, but enough. I asked her to stop and look down at her feet. See the difference? I asked. She looked carefully. Right leg. It's like slightly turned. Exactly. Then I asked her to stand on one leg, first left, then right. On right leg, she wobbled, lost balance, quickly lowered second leg. Hard to stand? I asked. Yes. Right leg somehow unstable. I nodded. Now asked her to lie on examination table and started checking strength of different muscles. When I got to right gluteus medius, everything became completely clear. It practically didn't work. Marina, I said, your problem isn't the knee, or rather, knee hurts, that's fact. But pain cause isn't in knee itself, because is that your right gluteus medius shut down, stopped working properly, and because of this, entire leg biomechanics changed. She looked at me puzzled. Gluteal muscle? But what does this have to do with knee? Here begins the most interesting part. What 97% of people with bad knees don't know. You see, your body isn't a collection of separate parts. It's unified biomechanical system where everything's connected. Gluteus medius performs critically important function. It stabilizes pelvis when you stand on one leg. And what's walking? It's sequence of moments when you stand now on one leg, now on other. When gluteus medius works correctly, it keeps pelvis level with each step. But when it's weak or shut down, pelvis drops to side. To compensate this, leg below starts rotating outward, trying to restore balance. And when foot rotates outward, knee receives rotational load. It's not designed for with each step. Thousands of times daily for years. This wrong rotational load creates excessive friction in certain parts of joint. Cartilage in these spots wears faster, inflammation occurs, pain appears, and you think problem is knee, cartilage, joint, but actually problem is gluteal muscle located 20 centimeters higher. But why did this muscle shut down? Marina asked. Excellent question. There are many reasons. Sometimes it happens after injury, even minor ankle sprain or lower back pain. Body attempting to protect sore spot changes movement patterns, and some muscles temporarily shut down. Problem is when acute pain passes, muscles don't always turn back on. They remain in sleep mode. Sometimes cause is lifestyle. Prolonged sitting weakens gluteal muscles. If you sit 8 to 10 hours daily, these muscles simply forget how to work. They become sluggish, lazy, and when you stand and start walking, they don't activate properly. Other muscles try compensating their work, but do it poorly. Sometimes it's a result of wrong footwear. High heels, for example, completely change biomechanics. They shift center of gravity forward, forcing body to compensate by changing muscle work. Years of wearing wrong shoes can create dysfunctional movement patterns that remain even when you switch to comfortable shoes. I explained all this to Marina, then showed her how to check gluteus medius function herself. Asked to lie on side and try raising upper leg, keeping it straight. She barely raised leg 15 centimeters and leg started trembling. See? Muscle very weak, but should be strong. Next, I gave her exercise program specifically aimed at activating and strengthening gluteus medius. Not general leg exercises, but very specific isolated movements, plus taught her proper walking, how to place foot straight, how to control pelvis position. Marina was skeptical. Doctor, you're saying if I do exercises for glute, my knee will stop hurting? I smiled. I know, sounds strange, but yes, exactly that. Give me 1 month. 1 month of regular exercises. If no improvement, we'll return to other options. 3 weeks later, Marina texted me, Doctor, can't believe it. Pain became much less. I thought it's coincidence, but really works. 2 months later, she came for follow-up. Pain practically disappeared. She could walk, climb stairs without discomfort. I checked her again. Gluteus medius working normally. Foot no longer rotating when walking. Single leg balance was stable. 2 years of pain, she said. So much money on procedures, so many pills. Turns out problem was completely different place. Why didn't anyone tell me this earlier? Good question. Why don't 97% of people know about this cause? Answer is multifaceted. First, modern medicine became very specialized. Orthopedist looks at knee, neurologist at nerves, rheumatologists at inflammation. But few look at body as unified system where problem in one place can cause symptoms in completely different place. Second, MRI and X-ray show structure, not function. They'll show you cartilage condition, bones, ligaments, but they won't show that gluteus medius doesn't activate properly, won't show wrong movement patterns, won't show muscle work imbalance. This can only be seen with functional examination, observing how person moves. Third, treating weak muscle with exercises is long, requires patient participation, doesn't bring quick money to clinics. Much easier and more profitable to do $500 injection or prescribed expensive physical therapy course. And telling patient, do these simple exercises at home daily, that's not business model. But here's what I'll tell you based on 30 years experience. Gluteus medius is one of most common hidden causes of knee pain. Not only one, but very common. I'd say in about 40% of chronic knee pain cases without serious structural damage, problem relates exactly to this muscle's dysfunction. There are other hidden causes most don't know about. Weakness of deep foot muscles that stabilize arch. When they don't work, foot collapses inward, called hyperpronation, and this transmits wrong load up the chain to ankle, to knee. Problems in thoracic spine that change posture and through compensation chain affect knees. Chronic tension in iliopsoas, muscle that pulls pelvis forward and changes entire lower limb biomechanics. Body is incredibly complex system of interconnections. Pain in one place rarely means problem is exactly there. More often, it's signal about imbalance somewhere in system. And if you treat only pain location, ignoring real cause, relief will be temporary. Pain will return because cause isn't eliminated. That's why it's so important to find doctor or specialist who looks not only at painful spot, but at whole body, who observes how you move, who checks strength and function of all muscles and chain, who understands biomechanics and connections in musculoskeletal system. If your knee hurts and standard treatment doesn't help, if MRI shows minor changes, not explaining pain intensity, think about this. Maybe your problem isn't knee. Maybe it's weak gluteal muscle or problematic foot or something else in movement chain. There's a simple way to start checking. Stand before a mirror and try standing on one leg 30 seconds, then on other. If on one leg it's significantly harder, If you wobble, lose balance, this is a sign of stabilizer weakness, primarily gluteus medius. Lie on side and try raising upper leg, keeping it straight, toes pointing forward. Can you raise 30 to 40 centimeters and hold 10 seconds without trembling? If not, muscle is weak. Walk barefoot and ask someone to video you from behind. Watch if pelvis drops to side with each step. This is called Trendelenburg sign, and it's direct sign of gluteus medius weakness. If you found these signs, there's good news. This is fixable. Targeted exercises for activating and strengthening gluteus medius can give results in few weeks. No surgery needed, no expensive procedures. Need right exercises and regularity. Start simple, lying on side, straight leg raises, 10 repetitions, 3 sets, daily. Sounds simple, but for weakened muscle, this is serious work. After a week, add exercise with resistance band around thighs, side steps with resistance. Another week later, single leg balance exercises. Main thing, do it correctly and regularly. Muscle won't become strong from one workout, but if you work on it daily, at least 10 minutes in month, you'll feel difference. And possibly your knee that hurt for months or years will start feeling better. Without pills, without injections, without surgeries, simply because you learned what 97% of people with bad knees don't know. That sometimes problem isn't where it hurts, and that your body is system where everything's connected. Eliminate imbalance in system, and symptoms often disappear themselves. This isn't magic. This is simply understanding how your body actually works.